Welcome to our community broadcasting network featuring the Health and Wellness Best Practices podcast. I'm your host, Dennis Streeter. Today's program will feature Mental Health Colorado. Started in 1953, Mental Health Colorado advocates for every Coloradan who experiences a mental health or substance use condition. They engage policymakers, providers, the public, and the press to promote mental well-being, ensure equitable access to mental health and substance use care, and end discrimination. Visiting with us today is Vincent Atchity, the President and CEO of Mental Health Colorado. Vincent, thanks so much for being with us today.
Thanks so much for having me, Dennis. Great to be with you.
Why don't you start out by giving us a little history and background of the organization? Your history is amazing, and I can't get over that. So I'm gonna let you introduce that to our audience.
Sure thing. Happy to. So Mental Health Colorado is the state affiliate of Mental Health America, which is the national organization that has affiliates in all states. Mental Health Colorado has been active in Colorado since 1953, so this is our 71st year, and we describe our mission as promoting well-being, working to increase access to housing, healthcare, supports and services, and working to end health-based discrimination. We do this work by passing laws and changing practices and trying to build a movement, because it really takes mobilization of public interest in order to make any progress on any of our fronts. And over the course of the history of the organization, I would say that it would be fair to say that we have been involved in pretty much every major move the state has made since 1953 when it comes to increasing access to healthcare supports and services for folks living with mental illness. We have been involved in spinning off a variety of different organizations that got their start within the folds of Mental Health Colorado, and have been major contributors to ongoing policy work as well as public education and the growth in awareness of the extent to which mental health and mental health considerations are an aspect of all of our lives.
All right, something that really piqued my interest on your website, talking about the history, is what spurred the action of an organization, Mental Health America, at that time, which, again, you guys were what happened in Colorado at the same time. You want to share a little bit about the famous bell that you guys were part of?
Sure. So the middle part of the 20th century nationwide was a period of reckoning with practices in addressing individuals' health needs that had come into the light of scrutiny. And one of the major considerations was the overuse of restraints in settings where folks had been sequestered and secluded based on their mental health needs. So part of the movement that yielded the bell in the early 50s was the dismantling of some of the state institutions' practices of using shackles to shackle patients securely to immobilize them in these settings. And so there was a moment in the world of mental health advocacy where the removal of the shackles was celebrated by destroying them and melting them down and turning it into a bell, an actual bell made of the metal from all those shackles that is meant to be a kind of liberty bell for the movement toward greater quality and supports and services for people with major mental health needs.
Yeah, when I got a picture of the bell up, and the inscription on the bell says, "Cast from shackles which bound them, this bell shall ring out hope for the mentally ill and victory over mental illness."
It's certainly an achievement in its time, and unfortunately, it remains aspirational because it is premature to declare victory.
Well, yeah, and actually, again, the more involved I get on the mental health aspect, the more I know what I don't know. And one of the things that really impressed me about Mental Health Colorado is you guys take on the really hard issues on the mental health side. I got acquainted with you through Senator Michael Wiseman, who is going to be doing some judicial reform work in the state Senate, and he's going to come on and we're going to talk about the idea of treatment rather than incarceration. And you guys are really in the forefront of that, aren't you?
Yeah, we've been calling it Care Not Cuffs, and talking about disentangling mental health and criminal justice, which in a landscape that is fraught with pain points from one end of the lifespan to another, possibly the most painful intersection of all for mental health is where we bump up against the criminal justice system. So a lot of our effort has been to do that disentangling, which really requires a reframing of understanding about what's driving individuals' behaviors and meeting those health needs with responses that lead people to have better health outcomes and better public safety outcomes as well.
Right, right. And again, your approach is really very collaborative. And I like that because that's kind of what I'm trying to do as well, is put together some collaborations so that we can have some strength in numbers and we can have some cross promotion, which is really important, particularly on the advocacy side. Um, you want to share with us some of the many programs that you guys do have going on?
Yeah, and I mean, just on the collaborative note, that the sort of guiding theme for the way we have done some of our collaboration comes from, maybe you saw the movie Hidden Figures about NASA to solve the problem of how to make it to the moon and back. And what I took away from that is that the way humans solve really knotty problems is by putting some of the best heads together and pointing at the problem to be solved, and then allowing sort of the magic of human creativity and collaborative intelligence do its work. So this intersection of mental health and criminal justice is a far knottier problem than it is to get an object out to the moon and back. And to that end, what we've been doing is convening some of the key partners across the whole spectrum of sectors that are operative at this intersection, and not feeling any obligation to bring answers to the table, because those answers are elusive. We just bring the questions to the table and keep a spotlight on those questions and ask insistently of all of the essential community partners, in the hopes of yielding the kinds of answers that are going to lead to the solutions.
Okay. Yeah. And that, again, that type of collaboration, I think, is particularly effective. Now, again, homelessness is a big issue. And you guys have a program for that as well.
We do. Over the course of our 71-year history as an organization, we've had all kinds of different areas of practice. For a long time recently, we have not done anything in the way of direct service until the pandemic started. And during the course of the pandemic, what was happening is that jails all over the country were rapidly shrinking their populations in order to be able to do better disease management in those closed settings. And so jails were discharging large numbers, some of them 40% of the population sometimes, who were not perceived as threats to public safety in order to reduce those jail populations. And we found in Arapahoe County, which is our local jail, that many of the individuals being abruptly discharged were folks being discharged to homelessness, who also had co-occurring complex health needs in mental health and substance use and other health needs. And so we participated in the formation of a community partnership that came together to do short-term sheltering for those individuals so that they wouldn't just be homeless, and then built a system of wrapping services around those individuals to make sure that they had a pathway to successful, enduring community reintegration by meeting their health needs and helping them get themselves back into action and on a path that would keep them clear of further justice involvement.
Well, sure. If you can help take care of some of the basic needs of living, then people can rise up, and I think that's something that's overlooked a lot.
Well, yeah, and much of our comfort and experience of well-being right now is due to the fact that we both know where we're going to be sleeping tonight. And take that away, and regardless of how healthy we think we are immediately a creature in distress, because it is not a friendly planet out there where we can get by comfortably without that stable shelter. So nobody who's not experienced homelessness should be too quick to underestimate the impact on their health of having a place to lay your head at night.
Yeah. And actually, when I started doing these podcasts the first of the year, I was focused on behavioral health. And actually, some of the legislators that I'm working with on Health and Human Services Committee said you can't separate behavioral health from physical health.
Right.
They impact each other. And that's, where I went with the health and wellness approach, because again, we really have to take a broader view of our situation, both mental health and physical health, in order to really treat it in the right way. Now, I know you guys also get involved in children's mental health, don't you?
Well, sure. When we were really trying to drive home, I mean, as you said, that intersection or the inseparability of mental health and physical health, I think of it as we need to revert to our original understanding of the word health, which when you look it up in one of those dictionaries that has an etymology, we discover that it means whole, or it's tied to whole or wholeness. And pretty much every move we make systematically in our world fragments us and divides us away from that whole self notion. And one of the messages that we drive home is that mental health, like physical health, is an aspect of all of our lives. And it's an aspect of our lives from one end of life to the other. And there's opportunities for supportive interventions that are productive of better health outcomes at every instance across the lifespan where some kind of need becomes apparent. And for mental health, as for physical health, there is no more reliably effective time in a lifespan to make a necessary needs recognition and supportive intervention than in childhood. Because the earlier a need can be identified and appropriate supportive resource put in place, the better the long-term health outcomes. So having an eye on the health and well-being of the kids in Colorado, starting in the perinatal time frame, that's money and intelligence well applied for best possible health outcomes.
I know you guys have a lot of resources, and you have ways that people can get involved. So you want to share some final thoughts with us about that?
Sure. One of the reasons why our organization has been influential in passing laws and changing practice over the course of our history is because we are the consumer voice for Colorado. We are a nonprofit organization with no vested interest other than to help Colorado make important strides toward being a healthier state. And that consumer influence comes from the voices of Coloradans who share their stories with us and with the elected officials with whom we connect them strategically. So to that end, we've got a group we've called the Brainwave, which is the grassroots network of Coloradans who've got lived experience of needing care or seeking care or providing care and can share their stories meaningfully and help us change the minds that need to be changed in order to make some important improvements in the way we address healthcare needs. So we encourage you to visit the website to join the Brainwave, and you'll get email notifications about letter writing campaigns to elected officials, as well as opportunities to provide testimony at the state capitol as certain bills are making their way through the General Assembly.
I'm a member of Brainwave now. I have
Awesome.
joined. I'm kind of excited. I want to do many more podcasts with the organization, and particularly with the Brainwave people, because they're the ones that are really experiencing life in the mental health realm. And in my case, people are aware of the fact that my wife has Alzheimer's, and that's a pretty large issue out there in the public. So the more I can share and help with my story about Sue, I think that helps everybody. So I'm going to invite you back as many times as you want, and some of your other people. You've got really quite an impressive staff of people there as well. So again, open invitation. So thanks so much for being with us, and hope to see you again real soon.
Thanks again for having me, and happy to connect you with anybody you'd like across the whole scope of things.
Thanks again to Vincent Atchity for being with us today. For more information and to learn how you can support their work, visit mentalhealthcolorado.org.